My name is Nasan. Today, I just want to talk about my story and how I worked with my mom with cancer. It might help someone somewhere, and it's good to know some of the challenges that I faced and how I overcame, and how my mom and my family member also went through it and overcame. My mom was diagnosed with cancer of the cervix the year 2015. I had just qualified from nursing school and I was newly employed at the Nairobi hospital like 3 months and so. And my mom has been having back pain since I was in high school. That is around 4 years. Let us say 4 years plus 3.5 or 4 years in college, and this is around 7 years to 8 years. And I used to say, like, okay, when I finish, I'll ensure that my mom doesn't work anymore, so that she doesn't suffer from the back pain. And she had gone to several physicians, several hospitals to actually try to find out or to get treatment to this back that was not responding. So when I was just working with my colleagues, doctors and nurses at the Nairobi hospital, I shared my mom's story. Like, my mom has had back pain, actually, for a long time. And what do you think it can be? And the first question he asked me was like, how old is your mom? I said, my mom is now 52 years. And he said, like, bring her for an pelvic and abdominal ultrasound. I said, no, I'm talking about back pain. I'm not talking abdominal pain. He said, yes, that's why I want her to do abdominal ultrasound or pelvic ultrasound. At this age, there are some factors that I want to figure out. And he kept on asking me, like, are you organizing for your mom to come? And finally, I did it. And only to find out that even my mom was or has been bleeding without telling me. Like, she is having postmenopausal bleeding, she's having heavy bleeding. And for them, for our mothers, they are very conservative. Me being a nurse, still she could not, being a nurse and her only daughter, she could not even open up and say, my daughter, I'm bleeding. So after coming is now when I started hearing from neighbors that she has been bleeding. So I organized for her coming to Nairobi, and we went for the investigation that were ordered by the doctor. And being a medic, you are also sensitive to anything, or you are vigilant. And when they were doing the ultrasound, I saw the radiologist calling another doctor, like, doctor, I need your consultation, I need your help. And for me, actually, I immediately knew there is a problem, and I started panicking, and definitely I started thinking of things to do with big conditions. And I also requested to join them. They said, of course, come, we check with you. And actually, the cervix wasn't looking good. And they just told me openly, like, okay, it's good for your mom to go for pap smear. And immediately we went for pap smear. It was done the following day. I think it was between 1 or 2 days. I was called, like, I was now referred to oncologist, gynecologist, who is Dr. Maranga by then, who did a colposcopy. Colposcopy is a biopsy done to the cervix, and he said, give me some days, we are doing staging so that we want to confirm actually if it is cancer. We want to confirm if it is cancer, and if it is, it will also give us staging, which was done. And actually, I was called to come to the clinic with mom for the results. My mom had not gone back to the village, and when we went there, he called me in first. He said, Anne, there is both bad news and good news. And I definitely knew things were not okay. And the bad news was cancer is positive, as in cancer is there. That was the bad news. And the good news was it was still in its early stage. It was stage 1, 2. So they say that it's good for your mom to know what she's suffering or what she's expecting. And I said, no, I know very well when my mom is told about cancer, she's not going to accept treatment at all, and it's going to stop everything. So he said, okay, if you don't want her to know, let her come in so that we know how to put it, because I'm not going to operate on a patient who doesn't know what is, you are a nurse and there's right for information. And I insisted, yes, give her information, but don't tell her like she has cancer. I know her. That's when she came in, doctor said, okay, we have noticed that you have been having back pain for a long time, you have been bleeding, we have done investigation, and we are suspecting that you might be having cancer. That's why we want to take you to theater to remove your uterus and take for investigation for histology to find out if you have cancer or not. So my mom was agreeable, and definitely we agreed on surgery. But here there was one problem. I told doctor, like, for me working in Nairobi hospital, I have seen people walking in with cancer, and it's millions of money. It's not cancer in Kenya is very expensive, and for me, I started crying, not because my mom has been diagnosed with cancer. I started crying because of finance. I was the breadwinner by that time, and I felt like I'm done. Where am I going to get all this money to treat my mom? At the same time, I'm not willing to lose her, and I have to try way out. And I'm happy because the doctor said, if you are ready for surgery, if you feel like I can operate on your mom, I'm going to do it free for now, but in future if you get money, you will pay me slowly. You don't have to pay me now, but we have to do this surgery as soon as possible because we have done colposcopy. We can't leave it like that. And I that's what we did. He also said that I might go in with another surgeon because we have different specialties, doctors of different specialty, and he called in a doctor who is specialized with cancer of the ovaries, because any cancer to the uterus, cervix, and ovary, they go hand in hand. So he requested to bring in another doctor during surgery so that they don't miss it, they miss out anything. That was okay. So surgery was done, and mom was planned for radiation and chemotherapy. And because of so many reasons at that time, many radiotherapy machines were not working in the country, and that's why I had to go to Aga Khan. Also, government had subsidy with cancer patients who were referred from Kenyatta to Aga Khan, and they were paying some amount to the patients who were going there. That's now where we started radiation and chemotherapy at Aga Khan Hospital. My mom was supposed to get a radiation 25 session, but after reading the histology of the uterus that was sent to laboratory after surgery, he suggested that he was comfortable giving 35 session, and she was also supposed to get 5 chemotherapy. And as you know, it is very expensive in Kenya, and only during Monday I used to carry 50,000 for chemotherapy and radiation. That is after subsidy, of course. And then from Tuesday to Saturday, it is 15,000 each day, around 15,000. And remember, in between here, we usually have investigators. We have to check blood level, to check if her HB is going down, what are the white blood cells, to check any infection. And so there are some costs that are being incurred there. There are some of the foods that I need to buy, some of the medication to counteract radiation and chemotherapy. It is hectic, it is very expensive, and I was at the same time I need to take care of my younger siblings at home, because now mom has left home and she was a single mother. I was to take care of their school fees, of their needs, and we had to give some of our younger siblings to the neighbors, and they're the one who were taking care of them while mom was here. I'm sorry, I might be emotional a bit, but that's how it was. And where I got money is just God. I thank the Nairobi hospital team, nurses. They came in hand financially. They used to organize for some funds to support me, and also some needs like counseling. Counseling was from my friends, nurses who have done counseling, and I'm grateful. It was not easy for me as a nurse. I knew some of the signs for depression, and actually I was almost going into depression because my extended family or entire family had limited knowledge on cancer, and they could not understand what I'm going through. For them, they, when you are medic, most people will leave everything to you thinking you are okay. I wasn't okay. I was going through a lot psychologically, emotionally, and socially. I lost many friends during that time, and it wasn't easy for me. The good thing is I was able to read some of the signs of depression, and I could run for counseling. I could go to church. I could talk to the priest, and they helped me walk for the around 7-8 months of the journey. And along the way, mom got sick. She needed to be admitted. She needed to stop radiation and chemotherapy for treatment. Those are some of the challenges you face along the way. You don't just fix yourself like, oh, it's going to be smooth. There are some complications, like they cannot cope anymore. And remember, now here my mom doesn't know that she has cancer. We when she was going in, we were taking her in to remove the uterus, to take for histology to check if she has cancer or not. Now she has started treatment. She just know that we are treating the wound that was caused due to surgery. Now we went on with the treatment, and luckily with the support and everything, I managed to go through all those emotions and whatever. She only remained with around 3 sessions of radiation. Chemotherapy was over. And most people, whether learned or not learned, you might not understand medical terms like oncology, radiotherapy. For her, we used to go to oncology center of the Aga Khan, but she could not understand probably the oncology, what it means. So here one of the patients asked her, like, what type of cancer do you have? She said, no, I don't have cancer. Actually, I don't have cancer. Me, I'm just here. My daughter is a nurse, and the doctors, they have agreed that I come for treatment. I was cut. She's giving all this story. And that patient was so clear, like, no, for you to be here, you have cancer. They're treating cancer. You have to know what type of cancer you are suffering. She called me and she wasn't happy. Like, why did you not tell me I have cancer? And it was shock to me, and actually I did not want her to know, and I noticed it wasn't right because she had a right to get information. But at the same time, I was still young, and I was in a lot of fear. No one to guide me. People assume when you're a nurse you know everything, you can carry every burden, which wasn't true. I finally told her, Mom, it's true, you have cancer, and we are treating. Yours is at early stage, and I'm struggling so that I don't lose you, and I want you to be with me. And she was like, I'm accepting to finish this treatment because I don't want to waste you. You have used a lot of money, and I have seen how you have been struggling. So, and that's the reason why she agreed to finish the session, not because she wanted. She told me, no one heals. When you have cancer, you are dying. Yeah, so you could have not even wasted your money. You can't lie to me that you are treating cancer and I'm going to get. She started mentioning people who have died of cancer even after spending a lot of money, even prominent people in the parliament who have suffered with cancer and they have died. So she wasn't happy that I hid this from her. And we actually, I had tried. I've even called the family sisters to come and talk to her, to tell her like she has cancer, but the moment they come, they freeze because they know her. They know how she'll react. They freeze. No one could manage to tell her, and it was hard for me. And actually, that's the time she realized she had cancer, but she's now doing well, and she accepted to finish the session. And some of the complications along the way, she could vomit, she could not eat anything, she had pain during micturition, especially because of the radiation. She had nightmares, she had fatigue. Yeah, there are so many complications that came along, and also infection. She could get infection and low blood level. I used to donate, I can't tell you how many times, but I used to donate because she had to continue with radiation, and sometimes I could not get people to donate for me, and I had to eat well so that by next month my HB has come up and I have to donate. So I used to donate. I know we are supposed to donate 4 times in a year, but I did that one four times in 8 months. So there are some of the challenges that I faced. As we are talking, my mom is well. She was supposed to be coming for investigation after every 3 months, which we did. Then moved to 6 months, and then moved to 1 year, and then after 5 years, she was confirmed to be free. And I'm happy. I'm happy that she's strong and she rarely gets sick. She's always in her farm. She's a good farmer. She's a she farms pineapples. If you come to our place, we have a lot of fruits, pineapples, and she's always encouraging people. Like I once had cancer and I'm okay. She's healthy. She's joining some of the support groups that are losing hope, to give them hope. And it's good for me to highlight some of the gaps that I noticed now that it forced. Through this experience, I went back to school to do more on cancer, palliative oncology. So for now, I have information and I know the right way that I was supposed to go. Actually, the right way was, she had a right for her to know what type of cancer she was suffering from. Yeah, that is a right of a patient to know. Don't hide information from the patient. And also, some of the things that I now know, there is what we call palliative center, whereby some complication can be managed in palliative centers rather than going to hospital. But for her at that time, actually, she needed the hospital, but because it did not take, or she did not have any complication after the treatment. I also noticed that our community have knowledge deficit on cancer. Any moment you are diagnosed with cancer, you have death sentence. They start asking. Actually, I used my family members used to call and say, just tell us if she's dead. You have buried her in Nairobi and you're not telling us. Actually, it was traumatizing even more to me, because they believe that we don't have that patient anymore. They erase you in their system, and it's not right. Cancer is treatable regardless of the staging. You just need to get the right team, you get the right support. And also, the person who is taking care of this person need to be taken good care of. It's not easy. It's not easy for the person taking care. It is you cannot explain. You can even become more sick than the patient. Also, financially is a struggle. It's a struggle. Once you are diagnosed with cancer, people might sell every property you have, or your family strains a lot. And if not captured early, you end up losing everything and not even achieving anything. It is also important for the people to know, like uh, going for screening is important. It's good to know some of the early signs of all conditions and not to ignore anything. It's good to go. And I'm happy that my family members, after that, they were positive. My uncles, my aunties were positive to go for investigation. And within 5 years, like now after 5 years, my mom lost her brother to cancer of the prostate, which is it's painful. It's, as a family, it's painful, but it is helping family members to go for investigation and be more alert and vigilant, because initially they used to think, like, in our family we have never had cancer and that can't be us. But now they have accepted that it might be here. It's not a good thing, but it is something that once it's there, support the patient and support the person taking care of your patient. Also, having gone through this, I'm able to guide so many patients who are suffering to the right doctors. Like, I have a privilege to have worked in the best hospital in the country, Nairobi Hospital. The professors, the doctors, the oncologists, all type of doctors, I'm able to access them. And apart from of course, I might not assist you financially, but I can assist you by giving you the right doctor, the right place, like even guidance. Yeah, that's why it helped me, or it made me to think of starting this channel, so that I might reach so many, because many people needs my support, many people needs my guidance. And I'm very happy that after starting this, most people are going to be helped a lot through this channel, because I'll be talking more on patient and cancer survivor. I'll start with my mom, of course, and other patients who want to talk about their journeys and any challenges that affect women and people entirely in the country. And I'm happy that our country, Kenya, is working very hard on cancer and building more cancer centers. And I want to urge the government, please, please, let the NHIF, the insurances support cancer as much as possible, right from the villages, and let them be empowered, knowing that cancer is not a death sentence. Cancer is just like any other condition. My mom is a living testimony. She's stronger than I am. I thank God. And don't fear. Once you are diagnosed and you are stranded, you can give a comment there. I can direct you to the right doctor within Nairobi. I'm vigilant within Nairobi. Able to connect you to the right doctor, to the right facility. I'm not saying I will direct you to my hospital or to the doctors that worked on me. Financially we might be different, but Kenyatta is there. We have more teaching and referral. We have many places. If I'm not able, I can connect with colleagues who can guide you. So I'm giving this story to empower someone, to give hope to that patient or to that family member who has lost hope, and to give hope to the country that our country, Kenya, is working its best to give the best facilities as we are talking.